So in this last demonstration, I'm just going to be showing you a couple of supine pulses that we haven't covered yet, ways to finish a session, and the sideline pulses. So I'll just start again at the supine pelvic pulse. Just rocking the body back and forth, sideways across the table. Going down into the smaller movements. See that beautiful movement going all the way down her body to the tips of the toes. And we're just going to come up to the top shoulder, side shoulder pulse. So these are just two supine movements that we haven't covered yet. Coming to the top shoulder. And we would use these if we hadn't touched the arms in a session and we wanted to include the arms. You could use this one. So I'm just going to ask Ariel to pass her hands over to me. Over her face. And we're just gripping above the wrists and pulling down with that traction again, straightening your arms, and we're just rocking the body. It's good to make sure that you've got a good grip a little bit further down so you're not pinching the skin around the wrists. Rocking the body back and forth. Going into a smaller one. Again, we can do an up and down one from here. Not a big movement. Back to the side to side. And as we put the arms back down, and we place them back down. Now we're going to do the body length shoulder pulse. So we're going to get right down here and we're going to have the hands, fingers at the front, thumbs at the back, and we're pushing down through the body with the hands right on the shoulder blades. So you don't have to get on your knees, you can get right down, but you have to be down low so that you're pushing down through the body and not down on top of the body like this, because that'll just push the arms and not the rest of the body. So we get down and we push that, and you can move your hands out over the shoulders if you want. And it's really good to do this one after you've done that double arm stretch, because it just pushes all that, the shoulders and the arms back down into place. So it's called the body length shoulder pulse. Okay, so we just come up. And I'll just show you a few ways now where we can finish a session. So we go back to the side to side. And if we were going to be finishing at the head, we would do lifting the cap, which I've already showed you a few times, but that is a lovely way to finish the whole session. So we've come in. We're just doing the head, the side rested head pulse. And then we're just going to Like I said, lift the cap, bringing the fingers in, a little bit more pressure as you bring your hands up and off the head. Times. So I lift the cap and then I go back, but you can just do it once, or if you're like me, you can do it a few times. It feels very nice. So just bring the fingers in, so sort of pressing down into the scalp a bit, and then straight off. And the other way to finish is on the supine, is at the core pulse, which I showed you before. We're just gently rocking, and as I said before, going down through the layers, then coming back up. As long as you want in this pulse here. It's a lovely way to finish the session as well. And the last way in the supine to finish a session is the palm sole. So we're getting the palm of our hands on the sole of their feet. So depending on how your wrists are, if you've got very agile wrists, you can get down and have the hands like this. If you haven't, just having them touching the soles of the feet. So whatever way is comfortable for you. It's just a very gentle rock. It's very comforting to have the soles of the feet touched. And we just do that and then gently taper off. So that's 3 ways to finish in the supine. So if we were in the prone position, we'd finish off with the sacral heart. So the hand resting on the sacrum, and this one over the heart. And again, just a very gentle rock. Very gentle and a lovely way again to finish. And just slowly bring our hands off. Again, just like I said with the core pulse, going down and then imagining coming back up through the layers. You can see that there's still even some movement happening there. Okay. So that's the way to finish sessions. Okay, so we're going to do the side lying pulses. This position is good for pregnant women, anyone who's a little bit incapacitated and can't lie on their back or their front. So we put a pillow at the top here under their head and a cushion between their legs, and we get a bit of a shape going here. We get them to put their hand on the table to balance themselves, and we start here in the sacral heart position. So again, a hand on the sacrum, one hand on the heart. You have to get down a little bit low, and you're just pushing back and forth. All these pulses are very gentle and soft. Do a whole session in the side lying position, including the spinal sequence, the arms, the legs, covering the whole body. So just very gentle movements. And then we go to the spine lengthener. So this time we're actually right over the spine, and depending again how your wrists are, I like to start here. We start in the middle and we're right over the spine with this part of our hand, and we're just gently pressing down and rocking. And as we do that, we move our hands And as we do that, we can move them out and along so that the spine is now in the palm of your hand. Go right down, and then we wave our hands back to the middle and we start again. This is the direct spine lengthener. So we go right to the top, right down to the sacrum, right down to the coccyx, waving our hands so that the energy is moving out and not back into the middle. Waving our hands back into the middle. Directly over the spine, so that the spine is basically ends up in that part of your hand there. And then the other one that we have in the side lying position is the direct lung opener, which has the effect of moving up and out. So we start again just at the bottom of the hanging ribs, and we're moving up along the spine, and then as we get up to the top we move out towards the sides of the body, waving your hands down and starting again in the middle and up and out. So again we have the energy going up and out, and we just wave our hands back down. Okay, so the other one is the hip shoulder pulse. So we have our hand on the hip, just above the buttocks, the sacral joint, and the other hand on the shoulder. And we're just going to move just gently back and forth. This is the hip shoulder pulse. As you can see, because they're in that fetal position, it's a very comforting, very nurturing pulse. Very good, like I said, for anyone who's not feeling a little bit poorly. And then the other one is one hand on the hip and the other hand on the knee. And we're moving, this is moving the leg sort of between our hands, like as you'd move a tennis ball between your two hands like this. So this is the hip-knee pulse. So you really are sort of getting across the body and going in that direction, down along here. And like I said, like you'd be passing a ball between your hands. So there are the main side-lying pulses. And we would just finish off in the sacral heart. So it's just again, hand on the sacrum, one hand over the heart, and a very gentle rock. You can do this pulse from the other side, which is quite nurturing as well. So if we were to stand on this side of the table, we might just move over a little bit. And we just have one hand here and one hand there. So you're almost hugging them, and that's a very nice, nurturing pulse. Just gentle and soft. So we'll just finish off here. Just bringing your hands gently off. And that's the last of the demos and the pulses that we've learnt in this level 1 course.